Hello everyone. In this video, we'll be discussing about the National Digital Health Mission, which has been recently launched by our Prime Minister when he addressed the country during the Independence Day celebration. So let's see what this mission is about and what are its attributes. Firstly, the most important aspect of this mission is that there is a health ID card. So connected to this health ID card will be all the records, all the medical records of a citizen, of an individual who's holding the ID card, like the diagnosis that he have been gone through, the consultations, the medication, all these details will be stored in regard with this health ID card. Secondly, this data will reside at individual hospital servers in a federated architecture. And along with this, the data can be shared only with the consent of the citizen. An NDHM comprises of 6 building blocks, which are DigiDoctor, the health ID card, as we have discussed before, personal health records, e-pharmacy, telemedicine, and health facility registry. So what are these things going to do? These building blocks are going to help to increase accessibility to healthcare services. Next, these core building blocks of NDHM shall be owned, operated, and maintained by the government of India. Although the government of India is going to maintain and all this platform and this project, we are also planning to integrate the private sector. The private stakeholders have an equal opportunity to integrate with these building blocks and create their own products. Now let's see who is taking care of this, which ministry is launching this, and how they are going to, what is the mission, what is the vision, and what is the aim of this mission. So National Health Authority, which is an attached office to the Ministry of Health and Family Welfare, is going to launch this mission. So this is the same office that's dealing with the Ayushman Bharat mission, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, and the vision of NDHM is to create a national digital health ecosystem which provides timely and efficient access to inclusive, affordable, and safe healthcare to all citizens. And it is also aiming to liberate the citizens from the challenges of finding the right doctor, repeatedly visiting the hospitals. So it's mostly citizen-centric project. It's going to ease um, all the things that the citizens have to do when it comes to healthcare sector. All right. So let's look at the significance. What are the significances when it comes to this mission? Firstly, as I've told before, patient-centric healthcare. So the system will lead to convenience for the patient, given that the patient will not need to store and carry all records. We know that right now what we have to do is we'll have to keep track of all the records, all the health records that we have. The documents and all have to be stored with us. We will have to remember everything, but with the introduction of this mission, and with the utility of this health ID card, all the information will be stored in a related to that health ID card, and the patient does not have to be responsible with the records. The next one is affordability. With the introduction of this mission, according to the government, the prices are going to come down and also improve accessibility. Well, the people are going to have access to quality healthcare, which is the next point. So it is going to reduce the price, it's going to increase the accessibility, and also it's going to give accessibility to quality healthcare. Also, the digital access to patient data can lead to more effective diagnosis. The data will also help in providing prompt and accurate treatment, especially in emergencies, by avoiding repetition of medical history, taking an unwanted test. So these 3 points here are showing how it is going to be patient-centric. And here it's saying that it's going to be affordable and telemedicine is definitely going to increase access. That's how they plan to increase the access, and also the e-pharmacy. It's going to give access to better medicines, and providing unique identification to doctors as well as health facilities can lead to streaming several issues of quality and accountability. And next will be integrating the stakeholders. Now, we know that there are different stakeholders when it comes to the health sector: the doctors, the pharmaceuticals, the healthcare providers, hospitals. So this platform, this mission is going to integrate, is going to bring everyone together. It's going to reduce the gap that's between these stakeholders, because it's going to bring everyone to the same platform. It's going to integrate everybody. Next will be data value. We know that in our country, when it comes to data, we lack data, because the future is about artificial intelligence, 5G, Internet of Things, and when implementing these technologies in our country, what is the primary problem is that we lack data. So this mission is going to enable artificial intelligence or other technologies when it comes to health sectors, because as this health ID card is going to be introduced, there will be huge data, and this will help in when we enable this technology, it will help in identifying diseases, identifying the pattern of diseases, and predict the onset of ailments such as seasonal outbreaks, and it's going to bring more efficiency and effectiveness when it comes to healthcare in our country. So next, we look into the challenges. What are the challenges when it comes to implementing this mission? First itself, the implementation. So we know that in our country, around 66% of healthcare sector contribution is from the private sector. All right, and when it comes to the diagnostic centers and pathology labs, a large number of them are run by private players, and so it is very important to integrate them when it comes to a mission like this, and that would be a challenge and something that the government have to address. Secondly, low digital penetration. We know that in our country, the communication infrastructure is not up to the grassroots level. So it is very much necessary when we are enabling such a mission that is about digital technology. Definitely, digital penetration to the grassroots level is important so that everyone can gain access. Next, data privacy and security issues. We know, so as we have told before, the health ID card is going to have all your health records, all your diagnosis, consultations, medications. So it is necessary to protect this data. When it comes to countries like India, what we have is a social stigma that's attached to certain diseases. So it is very much necessary to have a strong data privacy protocol, security protocol. As this mission, it's already mentioned that citizen only with the consent of citizens can the data be shared. But a much stronger data privacy and security protocol is necessary when it comes to implementation of this mission. Next is public health infrastructure and low public health spending. So we know, see, this mission is going to be a success only when it is backed with a proper advanced public health infrastructure. If we do not succeed in that, then this mission will be a failure. That is very much necessary. And how can we do that is by increasing the public spending in healthcare sector. So in our country, when it comes to public spending in healthcare services, it is a little more than 1% of our GDP. This has to be increased drastically, and only then we will be able to realize the positive aspects of this mission. So I'll be concluding with that. Do subscribe to our YouTube channel to gain access to more videos like this. Thank you.